Hi, I am Peter Smits. I'm an interventional cardiologist from Rotterdam, the Netherlands, and I'm also the Chief Medical Officer of CERC, a contract research organization located in Maasstad, nearby Paris in France. I would like to talk to you about CT, coronary angiography, CTCA. That is an increasingly important diagnostic tool for patients presenting with chest pain. It's now in the guidelines that patients presenting with chest pain as a first step should undergo CT, coronary angiography to establish whether they have significant coronary artery disease, yes or no. If they have significant coronary artery disease, highly likely they will go into a kind of revascularization pathway. If they don't have significant coronary artery disease, they will likely have medication therapy. One of the tools of CT coronary angiography is FESC.CMO, and FESC.CMO is an assessment of lesion severity. Usually it's now done invasively by a catheter technique where we measure FFR. If the FFR value is 0.80 or less, then those lesions are significant and highly likely need to be treated. Whereas the FFR value is above 0.80, those lesions are not hemodynamically significant and highly likely don't need to be treated. This FFR assessment can also now be done by CT coronary angiography. It's called FFR-CT. It's a very helpful tool that will establish more accurately based on CT angiography which patients need to go to the cath lab and which patients don't need to go to the cath lab. It will make our life much easier and medical science and medical practice much more efficient to select the right patients for the right diagnostic tool. So this FFR-CT is a very helpful tool. It's definitely very accurate in lesions below 40% stenosis, also very accurate in lesions with more than 60% stenosis, but in the sweet spot between 40 and 60% stenosis, there it's still the accuracy is not that good as the invasive technique. In that respect, there needs to be more development, and new tools need to be developed, and for that there are now several companies working on this, like Biome, working on a more accurate determining of this important FFR value of those intermediate lesions. Having said that, I truly believe that CT coronary angiography with all those new modalities like FFR-CT, plaque vulnerability testing, inflammation testing, and artificial intelligence and deep learning tools will make this CT angiography a much more helpful tool for cardiologists, and I know that in the next 5 to 10 years, the amount of CT cardiac CT angiography will increase dramatically. Having said that, goodbye, Peter Smits.